Hello there, this is a quick video for the benefit of anybody who is suspicious that they may be suffering from the initial symptoms of sinus cancer or may already have sinus cancer. And the most classical symptom of sinus cancer is of course the blocked nose that only affects one side of the head. And this also comes in conjunction with a decreased sense of smell and all the other consequent symptoms of this blocked nose. Now, just to clarify very briefly before I begin, this video is for the benefit of anyone who is suspicious they may have sinus cancer, unhappy with your doctor's advice. You may be suspicious that you have been misdiagnosed, like I was, on at least 3 different occasions. I'll go on to that in a moment. You may not have access to a hospital. This is in light of the fact there may not be one, or that you're reluctant to visit a hospital simply because COVID-19 is a serious issue at the moment and very clearly enters through the nose. To suggest to you COVID-19 virus does enter through the nose, and that is the primary entrance to the body, the primary route by which it takes to enter the body. So a sinus cancer patient is at particular risk if they visit a hospital, quite simply because they stand the risk of compounding an already very serious problem. And you may wish therefore to consider treating your cancer naturally from home, which is perfectly understandable, to say, in the light of this pandemic. And in light of that, you may wish to prove to friends, family, police, legal representatives, court officials, etc., that you have a genuine sinus cancer issue in the absence of a formal diagnosis. So, as I say, I personally presented myself at Poole Hospital. This is after being referred by my GP on 3 different appointments, only to be very seriously misunderstood and misinterpreted when I presented with all the full-blown symptoms of sinus cancer in 1996. Now, the indication here is very clear. Firstly, that specialists, not just GPs but specialists, have a quite poor understanding of sinus cancer, certainly in the younger generation, affecting the younger generation, not just the treatment. And the other indication is that this may be a far more widespread problem than we're led to believe or may first assume. In other words, I'm not the first person of 28 years old, which is how old I was at the time, to be very badly misunderstood and sent home just to cope on my own with all these awful symptoms. So in light of that, I would like to interrogate this issue and show viewers how doctors, ancient doctors in times gone by, were able to very quickly and efficiently diagnose sinus cancer in the absence of modern medical technology. And I suggest to you they would have done this very clearly, very simply, by interrogating this blockage to one side of the head that does not go away, which is a key feature of sinus cancer, and very clearly would have been picked up on by ancient doctors. As we can see here on the NHS website, the primary and most common feature of sinus cancer is a persistent blocked nose, which usually only affects one side of the head. And we'll find this everywhere we look. This is Cancer Research UK this time. Symptom list states very clearly the first feature: blockages causing stuffiness in one side of your nose that does not go away. And of course, ancient doctors 5,000, 10,000, 20,000 years ago would have been fully familiar with this symptom and used that to diagnose sinus cancer very fast and efficiently, quite possibly much more efficiently than we do today with the help of modern technology, which is very ironic. And how they would have done this is quite simply by using this method that I have on the screen here. The only medical explanation for a blockage to one side of the nose that does not go away, certainly not a cold or flu, because the blockage never lasts more than a few days before moving to the other side, as we're all very familiar with. Not sinusitis, ditto, blockage never lasts more than a few days before moving to the opposite side. A polyp provides a temporary explanation for up to 4 to 6 weeks, and I suggest to you this is a very clear indication that a polyp is a precursor to sinus cancer. In other words, poor lifestyle choices such as smoking, a poor diet, exposure to dust, chemicals, etc. will irritate and inflame the sinus lining, resulting eventually in the development of a polyp, a swelling inside the nose. And this behaves as a warning sign that you are about to develop cancer, unless you make some significant lifestyle changes, such as quitting smoking, improving your diet, and getting the hell out of a chemical dusty atmosphere. In which case you stand, I would say, a very high chance of being able to reverse the symptoms of this polyp and avoid it turning cancerous. And I'll repeat again, the polyp is a warning sign and a precursor to cancer, and clear indication that this polyp can turn cancerous if ignored. Now, if we look at the last option on the list, in more than 4 to 6 weeks, so yes, if we've ignored all the warning signs and we're at the 6-week mark, having experienced a fierce, severe blockage to one side of the head that has not let up or varied in its severity for 6 weeks, we are virtually 100% sure you now have sinus cancer. And of course, yes, ancient doctors would have been able to arrive at that diagnosis very effectively and very quickly, quite simply by listening to the patient. And as I say, indication that all the other symptoms, obviously, are a consequence of this initial one of the blockage to one side of the head is very clear. In other words, once this blockage really starts to expand and exact pressure on the head, then you start to get some awful consequences, which are all listed literally, below in a long list. Loss of partial vision, pain above the eye, a watery eye, loose teeth, difficulty opening your mouth, pressure in one of your ears, and it just goes on and on and on. And as I say, it's all a very clear consequence of the first symptom on the list. I therefore suggest to you that this is a far more effective and efficient way of diagnosing sinus cancer than many of the modern ways that we have at the moment. And it's also interesting to note that many GPs have no knowledge of this information, and perhaps ENT specialists could do well to revise and look at this, or remind themselves of this valuable information, quite simply with a view to helping patients. And if by any chance you are somebody that is suffering from this blockage to one side of your nose, and you are suspicious, having listened to this video, that you are a sinus cancer victim, then I strongly suggest that you start to look at one of my other videos. This is obviously in light of the fact that the COVID epidemic is now a very serious issue, and you may be reluctant to visit a hospital, quite obviously maybe panicking. And as I say, I have managed to make a video which I've got here, Treating Sinus Cancer 10,000 Years Ago, Recovered Knowledge, which attempts to collect and summarize all the treatments, experiences, tips and tricks that I gained over a 25-year period while struggling with the illness. And just to put you in the picture briefly before we go, this is me in 1995, 96, when I first developed all the symptoms, and the red line depicting the next 25 years of trials and tribulations that I was put through in order to find all the knowledge that I put in this video that I've just shown you. So I suggest to you I'm very qualified to pass on information to anybody else out there struggling with the initial symptoms of sinus cancer like I was 25 years ago.